This lecture is on parasites. So parasites are defined more based on characteristics of their life cycle than on anything else. And they're basically any organism that depends on a host organism, a different species, for at least part of their life cycle. They're a type of predator, but they're predators that eat prey in units of less than one. I like that quote by E.O. Wilson. They may live on their host or inside the host, often for an extended time period, or they may just come and, like a mosquito, suck some blood and then fly off. They usually need some food or other resource from the host. So there's something they have to get from the host that they can't get elsewhere. So mosquitoes, they only need to get blood in order to lay eggs. And in fact, not even all mosquitoes bite humans to get blood. A lot of them don't. Normally, they live off of flower nectar. Wow, didn't know that one, did you? So parasites do not always kill the host. You're not going to die from one mosquito bite. But they always harm their host. And a single mosquito bite, that's not going to cause you a lot of harm. But when they do cause the death or a lot of harm for the host, it's usually after an extended time period of infection and the parasite has reproduced either on or inside that host. So you end up with a large number of individual parasites. Most animals can tolerate low numbers of parasites. The parasites themselves are specialized for their lifestyle. They tend to be small, and sometimes they're completely lacking in structures typical of other organisms. So the tapeworm, which lives in digestive tracts of other animals, it's basically a mouth and a reproductive structures. And there's not much else there. So here are some examples of different kinds of parasites. On the upper left, we have an amoeba. Amoebas are single-celled eukaryotes. And this particular amoeba is one of the really nasty ones. It's fortunately pretty rare. But a more common amoeba causes amoebic dysentery, which is a diarrheal disease. And the dreaded malaria is caused by a single-celled eukaryotic organisms. These often live inside the cells of the host. On the upper right, we have examples of an animal. Many of the things that we call worms that are parasites, like hookworm, heartworm, tapeworm, are a type of animal. In the lower left, we have mistletoe, which is a plant. And in the lower right, we have a fungus. Lots of fungal infections are classified as parasitic. This particular one is ringworm. Don't let the worm part fool you. It is caused by a fungus. So, people can get parasites, especially some of these kinds of worms. If you think you have worms, consult a doctor. Symptoms of worm infections include gastrointestinal distress, which is a polite way of saying diarrhea, stomach cramps, vomiting, sudden weight loss, hives. Hives is a type of rash with raised bumps. It's pretty widespread. Or you might see worms or something that looks like rice in your feces. A healthy adult can support a small number of parasites with no ill effects. And there are lots of websites out there that give this huge list. Symptoms of worms. Well, a lot of these lists are so extensive and inclusive that they're useless. Does your skin itch? Well, it could itch because the air's dry in the wintertime, or you brushed up against poison ivy. Are you sometimes fatigued? Well, if you're an adult, you're probably fatigued sometimes, especially if you're going to school. So sometimes these symptoms that they list on these websites can be a sign of a different kind of problem. And you've got to be careful because what they're really trying to do is sell you something. They don't care if you have worms or not. And frankly, what they're selling isn't going to do anything, even if you did have worms. Do not buy a dewormer without seeing a doctor. Even if you see worms in your feces, don't go to the farm store and buy horse dewormer. Most people don't have the training to do the math to calculate an appropriate dose of horse dewormer for the human. So please don't do that. Treatment for parasites. So it really depends on the type of the organism. There are human dewormers. There are antifungals. And if you think about eukaryotic single-celled organisms like malaria, malaria is hard to treat. It is larger and more complicated than bacteria. It's more closely related to us than bacteria. And both of those things make it hard to treat. Most anti-malarials have pretty severe side effects. And I want to spend a little time talking about malaria. This is a disease that's probably evolved along with us since we became humans. We have seen, believe it or not, in the fossil record, evidence that there was a type of malaria that infected dinosaurs. So it's ancient disease. It is estimated that over the entire time the human species has been human, malaria has killed more humans than any other single disease. It has been incredibly deadly throughout our human history. Now, you sit there and you go, but Professor, we don't have malaria in the US. How can it have killed so many people if it doesn't happen here? It used to. We have eradicated malaria from lots of the world. In America, it was eliminated in the 1940s. Currently, malaria kills around 2 million people every year. Most of these are children under the age of 5. And it is such a problem that there are harmful genetic conditions like sickle cell anemia that persist in the human species because they offer resistance to malaria. They increase survivability. There are things that can be done to prevent malaria: window screens, bed nets. These are cheap and effective. Um, Using pesticides in malaria-prone areas if you know what you're doing. Um, where you treat, when you treat matters. Wearing bug spray if you're visiting a malaria area. And in October of 2021, the World Health Organization approved the first vaccine against malaria. Now, it's not a great vaccine, but it reduced infection in children by 30%, which is significant when you consider how deadly this disease is in children. Okay. Now, I want to talk about this idea called the hygiene hypothesis. It's an idea that Western society, especially American society, is too clean. We think this because in the Western world, autoimmune diseases and allergies are on the rise. Autoimmune diseases are when your immune system attacks your own cells, and allergies are when the immune system overreacts to external things like pollen. Allergies and autoimmune diseases are less common in people who, as children, lived with pets on farms or in very large, complex households. It seems that a broad exposure to benign microbes, things that don't really cause a lot of harm, help to train the immune system and reduce the risk of autoimmune diseases and allergies. On the other side, exposure to antibiotics increases your risk of these diseases. And the hygiene hypothesis, when it first came out, was looking specifically at infections with parasites. Now we've kind of shifted away from the idea that parasites are important to protect against autoimmune diseases and allergies, and are just kind of spreading the idea that benign bacteria as well as parasites are an important during childhood to help regulate and train our immune system. So you can use good hygiene to reduce the risk of infection. What is good hygiene? You hear this phrase all the time, hygiene. Well, good hygiene is washing your hands. Soap and water is fine. You can use alcohol hand sanitizers if you can't get to a sink, but there's no real reason to overdo it. It's going to dry out your hands, the skin on your hands, and it's not any better than soap and water. Clean your kitchen and bathrooms regularly. You don't have to use powerful cleaners like bleach, soapy water, vinegar, baking soda. These are all cheap and effective cleaners. They're going to take a little more elbow grease than a lot of the commercial products, but they do the job. And you want to avoid anything with a strong odor. Strong smelling cleaners can contribute to health problems. Asthma, headaches, especially in people who get migraines, and eye irritations. And they can irritate your lungs, making you more likely to get respiratory problems. If possible, open your windows. Turn on bathroom and kitchen fans while you're cleaning. This helps get these strong smells out of the house. These strong smells are a sign of something called a volatile organic compound, or VOCs. And VOCs, not so great for you. Okay, so that wraps up the discussion of parasites.